and how high blood pressure is really putting a damper on what's going on down there and how you might not even realize this. So I'm going to talk about high blood pressure. I'm going to talk about the medications. I'm going to talk about some of these side effects that you might be experiencing that you don't even realize. You have not put two and two together, because not a lot of providers are going to be out here telling you this kind of stuff and then telling you how to reverse it, how to correct it, so that you can start being intimate again more, have more fun, feel better, and enjoy it a lot more, and really do things that are going to save your life, to really help your overall health and wellness. So if this is the first time you're catching me, my name is Dr. Alex Rosa. I'm the founder and creator of Spice and the 90-Day Metabolic Makeover, and I'm an expert in all things intermittent fasting and metabolic health. I teach women 40 plus how to lose fat, balance their hormones, and get it on with the lights on. And today I'm going to be talking about something that's going to help you do exactly that, because we're going to talk about your blood pressure and your intimate health. So why am I talking about this? Because high blood pressure directly impacts your blood flow. And where do you need good blood flow? If you're trying to get busy, to your vagina, to your anus. I'm going to use all the right words this time in this video. Sometimes I don't always use the right words, but I try to make it relatable for everybody, right? So in your areas down low, we need good blood flow. And when you have high blood pressure, your blood flow is not the greatest. So that's one huge reason to get your blood pressure under control. Second is the medication. So there's a couple of things with medications that you need to be aware of. So medications, can have an impact on your libido, right? On your sex drive, like whether you're interested or not. So that's one thing. That's one side effect of these medications. Another one is that most of blood pressure medications have a mild diuretic, mixed into it. So it's going to pull fluid from your body. Well, we need things to be juicy down there. So we need all the fluid we can get, right? So if we're, doing a diuretic, it's drying us out, pulling fluid from our body. So these medications can have that type of effect. So that's another side effect, is some dryness, which is going to lead to some, uncomfortability down there, not feeling so great, not feeling so juicy down there because of this mild diuretic from your medication. Another thing to consider is electrolytes. So again, with this being a mild diuretic, it's going to fool around with the fluid balance in your body, which is going to mess around with your electrolyte balance in your body, particularly your potassium and your magnesium. Now, these two electrolytes are really important for muscle fiber action. And so we want to have like some good, we want to have some squeezing going on down there. We want to have some good action muscular wise going on down there. So we need our potassium and our magnesium to be at optimal levels. Well, most of the time they're not going to be, because you're on these medications for your blood pressure. Okay. So potassium, magnesium. So what are we going to do about it? Well, let me go back too. So we got issues with our muscle fibers, the twitching. So we can have twitching, right? But it can also cause you to have some heart palpitations. So some heart arrhythmias is what they're technically called. So you can have some abnormal heartbeats, palpitations, when your magnesium and your potassium are out of whack, whether they're too high or too low. So how can you, know this, start to correct this? What do we do next? Well, while you're on these medications, your healthcare providers should be drawing some basic lab work. So making sure to look at your electrolyte levels in particular. They're also going to want to look at, or should be looking at, your kidney function and also your liver function as well, to make sure we're not getting a buildup of these medications in those organs in particular. So those are some labs that you're going to want to have done and be monitoring and looking at. Okay. Next is replacement. How can we start to replace and replenish this magnesium and this potassium, right? So we always want to use food as medicine first, right? Food is medicine. So looking at foods. So foods that are whole, real foods, limited ingredient, or one ingredient foods. That's what we want. And you can go ahead and go to Google or wherever you want, talk to your healthcare provider, whoever, about foods that are high in potassium and high in magnesium. And so again, we want to be knowing what our baseline magnesium and potassium is, and then using food to replace. And actually those foods on their own have so many other benefits. Those foods that are high in potassium and magnesium have so many other health benefits as well. I'm not going to get into all that in this video, but just know we're talking about blood pressure, talking about replacing potassium and magnesium. That's what we want to look for. So whole ingredient, limited ingredient, one ingredient foods, that's what we want. Next, we can look at IV hydration therapy. So this is one thing I like for a bunch of different reasons. So we can look at rehydrating you, so replacing that fluid that you've lost through this diuretic effect. But we're also going to be able to replace your potassium, your magnesium, and a whole bunch of other things that are going to be helpful for your body overall to support your health, to get you to an optimal level of health. And we do it intravenously, and it goes straight into your cells. There's no wasting of it through digestion, through eating. You're not pooping it out because it's something that you ate. It's getting directly into your bloodstream and into your cells immediately. There's also some amazing infusions that can help with your libido, right? They can get you a little bit going, get that sex drive up. They can also help with lubrication and sensation naturally. So there's some little special ingredients we can mix in there that will help you in that area naturally. And again, you can also look to use a water-based lubricant if things are really dry and uncomfortable down there, which can also happen, right? Because hormonal issues, right, honey? We over 40 and things are drying up sometimes, and we're looking for ways to get the juices flowing. Well, the IV hydration, water-based lubrication, these are all really great things to kind of add to your little toolkit to help you in this area with your sexual health, with this particular thing, if you're dealing with high blood pressure and these medications and the side effects. Now, Dr. Alex, I don't want to be on my medications. I want to get off of my medications. I'm tired of taking these. My doctor just don't get me. My doctor doesn't want to listen to me. My doctor don't believe me, blah, 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 on and on. Okay, I got you. What you need to do is lose weight. Typically, weight is the number one driver of high blood pressure because you got a lot of body, you got a lot of surface area, your body's pumping a lot of blood, and that is what causes high blood pressure. So we want to be able to lower that. So lowering your weight 5-10 pounds, you'll see a really great drop in your blood pressure naturally because of that. So you got to lose weight. But that's one of the great things about looking at food for replacement for your potassium and your magnesium, because those types of foods are naturally low in calorie, high volume. They're what I call my high volume foods. For my intermittent fasters, and I teach about high volume foods, those are your high volume foods. Those are foods that are going to keep you full, satisfied, low in calories, high in fiber, high in phytonutrients, antioxidants, all that good shit that we need that will help you to lower your blood pressure naturally. It will help you to lose weight once you start switching over and having more of these foods in your diet. So you absolutely need to lose weight if you want to lower your blood pressure naturally. You also want to look at your stress and your activity level. You got to be really on point with your exercise, and you got to be really on point with your stress management. Because those two things will for sure drive up your stress or drive up your blood pressure, stress, worry, anxiety, all of that. So finding ways to lower those, being more aware of them, can help to lower your blood pressure naturally as well. So another thing you can do is intermittent fast. If you follow me, you know I always talk about intermittent fasting. It's one of the things that I teach and that I use, and I teach all my clients to use it. It's an amazing way to lose weight. You're not going to lose weight super fast, though. Let me put that out there, honey. And I don't teach people that's not sustainable, okay? But you can definitely lose weight through intermittent fasting. You can help to lower your blood pressure. It allows your body to heal naturally, which is what we are after, right? We want to tap into our own bodies again. Listen to our bodies. Let our bodies heal. Our bodies always know what to do. So let your body do what it needs to do. While you're intermittent fasting, your body is able to calm down and take any energy that it was going to be using to try to digest a bunch of food, because we're so used to eating 4 or 6 times a day. That's what we're told. Oh my God, you got to eat every 2-4 hours. You got to be eating something. Your body is always working on fucking overdrive if you're doing that. And it's never able to send any of that extra energy and focus resources to parts of your body that actually need to get healed, because it's always working on trying to digest shit. So let it relax, let it use its resources in other areas of your body that need healing. You can do this through intermittent fasting. That's just one of the amazing things about it. So let your body rest, let your body relax, start incorporating some intermittent fasting into your routine so that you can tap into this really amazing superpower of intermittent fasting. It will for sure have a big impact on your blood pressure and help to lower it naturally through this. So that can be one other little thing in your toolkit that you can turn to if you are wanting to come down on your medications and eventually get off of your medications. You always want to work with a provider though, honey. Just don't go doing this on your own. You want to work with a provider. Let your provider know if you're working with me. That's what we work on together. That's what one of the things that I specialize is we got to get you off of your medications, but safely in a controlled way. Decrease the doses, monitor your blood pressures, right? I'm always showing pictures of me monitoring my blood pressure on my little watch here, knowing what your numbers are, what's normal for you, where you're even at. I can't even tell you how many people I know that are on blood pressure medication that don't even take their blood pressure. They don't know. They're just popping pills, don't even know their blood pressure. You absolutely need to be empowered and knowledgeable about your body. So know what's going on with it. Know what your blood pressure is. Take it at least once a day. Every person, whether you got high blood pressure or not, should be taking their blood pressure to know, because that is going to be one of the first signs, signals that something is going on in your body if your blood pressure starts kind of going a little bit wacky from what it normally is, from what your baseline is. That's your normal, is your baseline. So what's your baseline? Okay. If you're watching this video, drop your baseline in the chat there. Drop what your blood pressures normally are in the chat, because mine's used to be 150s, 160s, 170s, systolic over like 90s, 100s. Honey, my blood pressure was a mess. And I was on like 2 blood pressure medications. They wanted to put me on a third one. I had went into heart failure after I had my youngest son. Oh my God, I was disaster. And I was in my early 30s. I was a fucking mess at that age. That's terrible. That's really bad. But lost weight, intermittent fast, do my IV hydration, using food as medicine, got my stress under control. I'm not on depression medication anymore, no more anxiety meds, because I had horrible panic attacks. Let me tell you, terrible. And all of those medications have side effects. And many times for women, those side effects follow us into the bedroom, and they affect our intimacy and our love lives and our relationships, all because of just this health issue. So we need to get our health fucking in check and under control so we can enjoy all the parts of our lives. We can enjoy being women fully, express ourselves, enjoy, receive, right, honey? So I want you receiving something, giving something out here. So get your health in check. Quit playing with your health. Do something about it. If you follow my videos, that's amazing. And follow my content, great. I love that you're inspired and that you like what I talk about. But honey, I want you to save your life. I want you to do things with the information, implement it into your life, do something with it. Save your life. Teach what you learned to somebody else so that way they can change their lives as well. That's what would make me happy, is for you to be doing that. Okay. So that's my video for today. And if you found this helpful, share it with a friend or leave your comments below. If you got a question about intimacy, women's health, your blood pressure medications, you can always drop it in the chat or send it to me privately. If you want to be a little bit more discreet about it, if it's a little bit more sensitive, send me a message and let's talk about it. If you want one-on-one support to help you get off of your blood pressure medications, to lose weight, to get it on with the lights on, honey, then you know who to call. Reach out to me. Book your call with me today so that we can talk about and formulate a custom tailored program just for you. Because nothing I do, honey, is cookie cutter. It's all based on the individual woman and what she needs and what she wants. So if you're ready for that and ready to elevate that part of your life, honey, then book your call with me today. So thank you again for joining me. And like I always say, for a balanced life, just add spice. I'll catch you in the next video.